experience leading digital transformation across the healthcare and public sectors. Montana is widely recognized for her leadership in modernizing systems, advancing digital health innovations, and strengthening governance and accessibilities in public service. So, she is also a doctoral researcher, a author, and a thoughtful leader on AI ethics, digital transformation, and inclusive innovation. So we are honored to have her with us today as she take us through a timely and exploration on how artificial intelligence can shape the future of personal and public health. So with that, please join me in welcoming Miss Montana. Over to you, Montana.
Thank you so much, Dr. Nair. I appreciate that. Good morning, everyone. Welcome to an exciting session on Can AI Keep Us Healthier? So without further ado, I'm going to jump into our first session. Thank you for being here again. Good morning. As you know, healthcare is going through a transformation more dramatic than anything we've experienced since the invention of antibiotics. But unlike previous innovation that focused only on biology or medicine, this change is being driven by intelligence, specifically artificial intelligence. When we think about healthcare, we normally think about stethoscopes, hospitals, nurses, prescriptions. But today, healthcare is equally a science of information, connection, and intelligence. Data is becoming as powerful as medicine itself. In the next hour, I want to take you on a journey, not on a technical one, but on a human one. Not a story about machine replacing people, but about machine helping us recover the humanity we lost in healthcare. We'll travel from the early days of paper charts to predictive models, to global use cases from India, Dubai, Africa, Europe, China, and even North America. I will help you explore how artificial intelligence is currently improving access to healthcare, reducing work burnout, elevating safety for patients, and truly creating a brand new model of care. And by the end, I hope you'll walk away with new understanding of AI in healthcare. That is not a machine story, but a human story about compassion, equity, and the future we want to build. So let's start with the evolution of healthcare, because AI didn't appear out of nowhere. It sits on top of decades of digital transformation. So let's start with phase one. If you remember back in the day, and God knows from my own experiences as a child, I remember going to the doctor or hospital, and my mother had to bring a stack of my files from other doctors. The doctor was usually see me with a clipboard, would take my information, would really just talk to me and talk to my mom, take the, if we had any referrals or papers, they would take that. And at the end, they would sit somewhere and consolidate all of these manually. So that was phase one that we call paper everything. And for most of history in healthcare, everything was handwritten. And if like me, you have any doctors in your family that you know that the handwriting of doctors are very bad. So good luck to other people that have the art and ability to read those. So it used to be very manual and handwritten. If a doctor wanted to know your medical history, they would have to flip through thick charts of patient data. And I remember health record departments, they're still in the basement of many hospitals. You would have to send someone to go and retrieve your files if you wanted to see something, and they would have to spend a lot of time going through literally stacks of paper to find what you're looking for. Sometimes papers are missing, sometimes they're damaged. Sometimes the notes are not readable because the doctor's handwriting looks like an alien note, or it's just simply outdated information. Moving forward, what I call a phase two is early digital records. So that's in early 2000. Some countries began to adopt electronic medical records. And what is electronic medical record, or EMR? EMR is, imagine you're going to your doctor's office, and they now have a system. They pull out your name, they get your identifiers, and hopefully your patient history and many other information is linked to that. So, from a clinician's perspective, nurses and doctors, it's called electronic medical record. Same thing applied to a bigger ecosystem like a hospital. It becomes EHR, electronic health records, electronic health information systems. And there are many companies that specialize in both, bring in EMR for doctors and EHR for hospitals. And at the end of the day, they need to speak to each other. So in early 2000 countries, they started adopting these electronic systems. There was no intelligence. It basically just turned papers into PDF. And I remember we would scan them, no structure, garbage in, garbage out. Important, but not transformation. And in phase three, it was about making the systems talk to each other, not just EMRs and doctors, clinicians, and not just EHRs and hospitals, but also diagnostic labs started having systems. So when a patient would go for a blood test or whatnot, their result would automatically be sent to their doctor or the hospital. So, you know, you have digital pharmacies. You go to a pharmacy and they ask, oh, who's your doctor? So they do have the ability to look up your doctor, hopefully through a doctor or a clinician registry, and be able to transfer your data to who you want, not by just giving you a stack of paper for yourself to take to different doctors. So phase three was all about integration, labs, pharmacies, x-rays and imaging, your primary care specialist, you know, when God forbid you have an issue, you want your family physician to send you for a referral. Phase three was all about integration, how to connect these siloed systems together to speak to each other. And honestly, we still have a lot of challenges in integration. Phase four was analytics and cloud system, the invention of those. Hospitals finally had enough data to start learning from the patterns. And what I mean by pattern is, you'll see in later slide when I explain artificial intelligence through analytics, is which patients were likely to be readmitted, for example. And finally, in phase five, we had AI insights. And now we use machine learning. I'm sure you heard of ML, is pretty hot topic. Machine learning models to help detect early signs of disease, optimize patient workflows, predict shortages for clinicians, services that are required for patient, and finally, personalized care. You see, when you take a look at the history of medicine, it was generically for, say, a 35-year-old male of Caucasian race. However, that's not really the reality of personalized care. So when we talk about personalized care, it's a care that takes in mind, per se, your personal characteristics, your genetics, the region you're born, family history. This is not all, you know, cookie cutter templates that we can generalize. Sure, maybe to 70 to 90% it works. But again, a lot of the history of medicine is biased, it's sexist, it's mostly just includes male, and it excludes females from a lot of treatments. And even up to date, there's more research on men over women. So AI will really help us to see these disconnects and try to build a more equitable system that actually takes a look and says, actually, you're only looking at disease profiles for Caucasian countries, and you're not taking into consideration India, Middle East, West Asia, or Africa. So AI will really give us insight to be able to optimize workflows. And an essential topic would be health equity, just to ensure that underserved communities receive the attention and the healthcare that they so very well deserve. And finally, phase 6 is predictive and proactive care. And that is the future that we are going through. And what I mean is um, healthcare system that anticipate the problem before the patients feel the symptoms. For example, right now, every time you go and get a diagnostic imaging, your information can be added to an AI detective system that is way more superior than human eye. And from different patterns from your diagnostic can help your physician predict your personalized outcome. It can build in your DNA and the disease profile that's hereditary and put personalized insight to help you specifically, not just take a look at you just as another patient, but truly understand your personal needs that are based on your DNA, your deoxynucleic acid, and based on that, really tailor the medicine that is personalized to you. So let's take a step back, artificial intelligence, and in simple terms, I will try to explain what it is. And God knows I tried this for my mom many times and she still doesn't get it. You know, I know there's a lot of hype and it might sound very intimidating, but if you really take a step back, you can really simplify AI for everyone in the. So whether you're a healthcare worker, you're in technology, business, or simply curious, AI basically means a software that learns from data. For example, in healthcare, it can help with spotting anomalies in scans. So something that's not visible from your physician or clinician's eye, they can take a look and they can detect anomalies that are so small that previously we did not have the ability to do so. It can recognize early signs of sepsis and infection before it occurs and really notify your healthcare worker to intervene so it won't happen in the future. AI can generate summaries of clinical notes. You know, a lot of burnouts, and a lot of time when I speak to our nurses and doctors, one big complaint is I am tired, and the more I want to engage with the patient, I know that I have to type up more later to go through everything. And sometimes I don't remember. So because of that, they try not to speak as much because otherwise they have to document that. So imagine not imagine having that burden of having to literally after every visit sit down and have a document that in the future can be legal in a court setting. So you need to have a date, time, what was said, what was the action. It becomes quite tedious for physicians and nurses to work with that. So AI can actually come in and take over those, informed decisions and do your all of your paperwork for you automatically. So it will reduce that burden. Traditional AI is really pattern recognition. This is unlike an extremely fast assistant that looks at thousands of data points and spot patterns that humans might miss. Example, early detection of breast cancer using imaging AI. This is happening right now. It's in pilot, and I'm so excited. I have been part of projects that do that. So instead of just traditionally taking a look, they send that to AI system that really analyzes the data that it can detect some things that even last year we were not able to. So all of these are helping increase morality and reduce mortality rates. Another example is generative AI. Generative AI is the newest of the AI family, and it is what most of the world is right now excited about. It can create summaries, letters, instructions, and synthetic data for training. So it's not just a system that detects, it can also act. And again, through human supervision, because that's essential, as we will see later when we train our agents. So agentic AI, it's kind of an AI that just doesn't answer question. It acts, it performs, and it can help us with scheduling, request follow-ups for your patient, send reminders, analyze trends, and summarize the outcomes. And of course, all should be under human oversight because you don't want them to take over. So AI is not the plane, it's like a co-pilot that will help us drive through. All right. So why AI and why now? You know, AI didn't appear just because the technology became available. It arrived because healthcare systems around the world are really struggling. They're facing three global pressures right now. One is the workforce shortage. So no matter where you are in the world, I'm pretty sure you heard of a shortage of doctors, shortage of specialists, shortage of nurses. Uh, you know, burnout is at all-time high globally. By 2030, the world may face a shortfall of 10 million clinicians. So let that sink in. The second reason is the rising cost, inflation. Healthcare is becoming unsustainable. Most of the countries spend up to 20% of their GDP on healthcare. So that's not very sustainable. And finally, it's the patient expectation. This generation wants immediacy, mobile results, apps, shorter wait times, virtual healthcare. You don't have to physically go anymore. Let's have a video call. Why do you have to, travel 50 kilometers to see a physician when you can have a video call? What if you can connect devices to your own app or at home that can help your doctor track your blood pressure and other monitoring tools for patients? So remote patient monitoring, supporting diagnostics, predicting patient needs. But also the deeper point is AI isn't just about efficiency, it's about restoring humanity. And that's something I really like to emphasize today. They're not here to take over, but they're here to really help us restore our humanity, give us the time that we need to spend with patients again without having to worry about running to do paperwork. So it will free clinicians from keyboards, giving them the time they back with their patients. It will reduce the stress and cognitive overload. And AI is arriving at the exact moment to heal. Now, let's take a look at some of the global use cases. For example, in North America, I'm in Canada. So in North America, we have documentation, artificial intelligence, several tools like Nuance DAX, AI Scribe, Average, and others automatically generate clinical notes during patient visits. And what I mean is you bring this tool or you enable a listening device on your laptop when you have the patient, and all of a sudden, you don't have to talk to your patient having the clipboard. You can actually put that down, and if you want, you can hold their hand, look into their eyes, and just have a dialogue without worrying about taking notes. And I'm sure all of you have been to the doctor's office. Imagine if the doctor didn't have to have that chart frantically writing down what you were saying and was truly just looking at you and listening, because there's an assistant in the back listening to every word and analyzing, transcribing, and sending you the note. So it really can reduce the burden, at least by taking that. So that's just one example in North America that right now we have implemented, and there's some innovation funding for Canadian healthcare providers to apply, and we'll be happy to support them in order to implement those. Let's go around the globe in Europe. And Europe right now is very high. It's the X-ray and imaging artificial intelligence. Radiologists use AI for early detection of cancer and strokes. It's like having a second pair of eyes that never get tired. Let's go to Africa. Currently, there are drone medical logistics. So in Rwanda and Ghana, drones actually deliver blood and vaccine to remote communities in minutes instead of hours. So imagine the beautiful impact that this will have to give patients what they need within minutes as opposed to hours or very expensive airplane or logistically, it will really help accelerate access to care. AI plans routes, manages the inventory, and monitors the quality. Let's take a look at India. ABDM Digital Health Mission. India is building one of the world's largest digital health ecosystem, a national health ID, interconnected clinicians and AI-enabled telemedicine for millions of citizens. And let's take a look at West Asia, formerly referred to as Middle East. They're implementing smart hospitals. For example, Dubai is investing heavily in AI-driven hospitals with unified health records, real-time patient monitoring, and even robotic automations. So they have robots that for rural areas that there's no access to, say, specialist surgeons, through installation of robots remotely, physicians can actually perform surgeries. One example is the robot called Da Vinci. It's truly mind-blowing. Excuse me. So you see, what we see is the AI's biggest value is not the flashy gadget. It's really solving the real problems, which are access, accuracy, efficiency, and equity. As I alluded, equity is very important. So imagine a mother in rural Rwanda receiving life-saving blood for her child in 17 minutes instead of waiting days or hours. So that's truly life-changing. And this is one of the small things that AI is doing today. Another exciting project that this year I followed in 2025 is Tishwanga University in China, the Agentic AI Hospital. So I think to me, this is one of the most fascinating developments that we've had in 2025. And God knows, I've definitely been following this religiously. China's Agent Hospital, it's a virtual hospital. So it's not a real hospital that you can walk in right now. However, it's a simulation. And it's not a real building. Inside it, well, it started with 18 and now there's thousands of AI doctors that treat millions of digital patients. So why is this a big deal? It's like using a flight simulator to train pilots, but for healthcare AI. They can test triage workflows. And if you wonder what triage is, if you have, God forbid, had an accident or you've been in a hospital, the first step is you go to registration. Once they register you, give you a band, a nurse will see you right away and will assess your vitals. Based on your condition and the assessment, you will be classified from level 1 to 3. Level 1 is this patient needs immediate care. Let's bring a bed and take him to surgery right away. Level 2 is, okay, and unfortunately, for example, in Canada, we have a lot of wait lists, like an emergency room anywhere. If you're lucky, from 3 to 13 hours, sometimes you have to wait. So triage coordinators are really important roles in Canada that assess where the patient goes, what level of priority they're to be seen. So it gives them, this patient is level 1, so 1 to 3 hours. Level 2 is not that bad, so maybe 6 to 10 hours. And level 3 is, okay, this patient is going to be okay. And the reason they do this because they're really limited in their resources. They can't jump and help every hospital, every patient that walks into the hospital. Rather, they have to prioritize and keep patients alive. And triage is one of the processes that you will hear throughout this project that AI is going to really help us. And it really helps with the patient flow. So before touching a human, this AI agent in China is actually uh, testing all of these interaction. And it's so important because by 2040, we may see AI assistants supporting routine triage, medical education, and logistics, and always within the human, with human in control. We are not fully trust AI to let them go wild, wild west, if you say. We still need to ensure human oversight. And the reason for that is many years ago when we were just starting AI, we saw that some of the AI chats that were being trained started bullying some of the online people on group chats. So it was truly mind blowing. The root cause was it was learning from an open system. And as you know, in an open system, if you ever been on a Reddit topic, you see that, internet trolls are everywhere. Bullying is everywhere, unfortunately. So AI actually learned from those biases and started bullying people. So this put in place many issues for us and really helped us start to think about, okay, how do we control this? We have to train AI on good data. And China's AI hospital, this is another reason that they're doing this testing. It's very crucial. All right. So let's do a fun exercise and let's take a look at the next 15 years of AI in healthcare. Let's start with now and the next 5 years. So 2025 to 2030. This is predictive triage mainstream. So triage is, again, you see the patient, assess the priority, you send them to whoever they need to see. So the humans do not have to do that anymore. We're going to have predictive triage. So as soon as someone comes in, based on what we know from their history, physical symptoms that we assess, we can automate all of those. Emergency departments will use this to flag high-risk patients before the symptoms escalate. Clinicians and doctors can use automated note-taking, and hospitals predict staffing needs. So these are very important, and these are real problems right now we're facing. Moving on to the next phase, 2030 to 2035. These would be personalized care pathways. So customize, tailor healthcare to every person's genetics, lifestyle, environment where you're living, and habits. Chronic disease care becomes home-based rather than hospital-based. And this is so exciting. We have started seeing wearables. Well, God knows I have one. If you have a smartwatch, it measures my heart rate. A lot of time it can measure oxygen intake. This becomes expanded. We have even stethoscopes that can connect your laptop, or even if you have a smart home, really monitor your vitals. So again, all of these will be normalized. So you can expect a lot of improvements and personalized care. Your DNA, if you consent, can be used to take a look at your patient history and what might come and put in place preventions that will help you with your healthcare. Moving forward to 2020, 2035 to 2040. This is continuous intelligence monitoring. Wearable becomes way more. Home sensors now, instead of now just the laptop and this, you can start to install and incorporate sensors at home that through whatever you want it to be. Like for me, I do have some AI cameras already in place. As sometimes I live alone, so if I do have a fall, I have an agent AI that calls my next of kin or whoever I want and has a message to cascade. So I am starting to incorporate this myself in my smart home, but by 2035 and 2040, this is going to become mainstream. So maybe when in those years, builders are building our kitchens. They actually come and say, oh, we need an imaging station here. And, imaging station and all of these tools that we use in medicine are huge. You think of the first computer that was invented, it was size of a room, and now you can have it on your phone. So again, um, the tools and the diagnostic items that we need become smaller, and as they become smaller, we will be able to incorporate them in our everyday life. So now let's shift from a tool uh, to being the orchestrator of a full ecosystem, and that is the last. Quite exciting. Imagine a world where your home becomes your first hospital and AI becomes your daily health guardian. So I just wanted to go from a regional outlook and take a look at some of the big regions and what they're doing. So in India, as I alluded earlier, its digital health mission, ABDM, is integrating records for over 100 million citizens, allowing AI to deliver telehealth at unprecedented scale. Truly mind-blowing. In Dubai, a national AI strategy has been in place. They have projects for smart hospitals that have started, and a unified record system like Malafi and Nabida are building a data foundation for precision medicine. In Africa, Rwanda and Ghana are pioneering drone logistics, while Kenya and Nigeria expand mobile health AI solution for diagnostic and maternal health. In Europe, the European Union's new Act 2024 AI Act classifies health AI as high risk. This ensures that the governance and trust through mandatory oversight is implemented. So they can't just go and implement. There's a lot of red tapes and a governance that they have to proceed and go through. And it's very justifiably. In North America, where I am, the FDA's new predetermined change control plan allows continuous learning AI in approved devices. This encourages safe innovation. As you know, AI does require a lot of data, and the more data, the more predictive we can do because it detects the anomaly. So with AI, something we have to always keep in mind is it needs a lot of data. So data is at the foundation, essential part of AI that's trained properly. So, every region globally is advancing differently, yet the destination is shared. We need ethical, equitable, and efficient healthcare for all of us. Now, technology alone cannot transform healthcare. Trust can. World Health Organization in 2024 and 2025 put guidelines that stress that the success of AI depends on fairness, transparency, and accountability. So if you want to get into AI, memorize these three principles: ethics, equity, and trust. Let's take a deeper dive. What is data fairness? Systems must learn from diverse population to avoid bias. If you recall earlier, I talked about some of the chat AI agents in early days that were being trained through public channels, and they started actually becoming like those bullies online. So that really raised an alarm. So we have to be very careful on how we train AI, and we have to provide a very diverse set of data so it can learn from that and it won't have bias towards, say, just one race or one country. We need equity for all of the underserved uh, global regions, India, Africa, Middle East, everywhere, not just in developed countries. So Based on these principles of data fairness, this can assure us that those protocols are in place. Another pillar that's very essential is transparency. You don't want a black box that gives you a decision without explaining why. This is because there is a phenomenon in AI and a big risk called hallucination. So some AI models want to please and they will make up things that are completely incorrect. So because of that, we need to have transparency and when needed, truly see how AI reached that conclusion. So through prompt engineering, we have to build transparency so the clinician and patients can understand how AI reaches its conclusion. And it's not just blindly giving us something that we will accept. And finally, the third very important pillar is accountability. There must always be a clear line of human responsibility. AI must be governed like infection control, invisibly, constantly, and systematically. Without trust, even the most powerful model will fail to scale. The ethics conversation isn't separate from innovation. It is innovation itself. Now let's talk about the human AI partnership. AI amplifies human ability, not replaces it. Many people I talk to, especially some older generation, especially from West Asia, formerly known as Middle East, they are worried about AI taking over. There's a fear. So let's talk about what AI cannot do. AI cannot feel. AI cannot empathize. AI cannot replace human connection. But what it can do is reduce the burden, reduce the documentation burden, support decision making, and the free clinician to focus on patients. You know, the future is not human versus machine, it's human plus machine. AI gives us the speed and memory, and human give meaning, compassion, and ethics. And together, they create a better care. Now, let's talk about leadership. To make this future real, we need leaders who can bridge medicine, data, and ethics. That means cultivating three capabilities. Digital literacy. That means we have to teach people and have them understand what AI can and what it cannot do. So really setting that realistic expectation. Second is very important for ethical grounding. We need to embed fairness, transparency, and accountability into every initiative and implementation. And again, we have to have a collaborative mindset, uniting clinicians, technologists, and policymakers. Let's not compete, let's partner. So the collaborative mindset is really huge. And I really hope that you take that away as your future leaders. Do take a look at that because together as human race, we are definitely stronger. The leaders of tomorrow won't just manage technology. They will orchestrate information. Whether you're in Canada, Tunisia, Mumbai, or Munich, leadership in this era means guiding innovation responsibly while keeping human dignity at the very core and the center. Before we end today, I want to leave you with one final idea, and it's the idea on this slide. Technology will shape the future, but humanity will define it. We are living through a moment where AI is moving faster than any other technology in human history. It's writing, speaking, analyzing, predicting, learning, and sometimes in a way that feels almost magical. And yet, even with all of that power, AI cannot do the one thing that defines healthcare. It cannot care. AI can recognize patterns, but it cannot recognize pain. AI can detect anomalies, but it cannot detect fear. It can help plan a treatment, but it cannot hold someone's hand while they're receiving it. That part still belongs to us. And as AI becomes more capable, our job is not to compete with it. Our job is to teach AI what matters: fairness, compassion, dignity, safety, equity, and ethics. AI learns from us. AI is a reflection of us. So the future of healthcare will depend on the values we build into today's system. If we design AI without empathy, we will create faster system but colder care. If we design AI with humanity at the center, we will create something extraordinary. A healthcare system that finally feels personal, proactive, and equitable. And that is why all of us are here. And that is why um, this matters. Whether you're a student, a clinician, a data scientist, a policymaker, or just somebody who's simply curious about this space, your decision, your question, your leadership will shape how AI enters the world. Technology does not decide how it's used. People do. We do. So as AI becomes more advanced, ask yourself, how can this tool make care more human? How can it reduce suffering instead of increase inequity? How can we use it to empower both our doctors and patients? And how can AI help us return to the heart of healthcare: trust, empathy, and connection? Because if we do the right, AI will not replace human soul of healthcare. It will help us protect it. And that is the future I believe in. A future that is digital intelligence connected, but is still profoundly human. Again, thank you for joining me in this exploration. Thank you for your curiosity and openness and your energy. And thank you for believing that the healthcare can evolve, not from humanity, but towards it. And that concludes my session. And over to you, Dr. Nair.
Thank you, Mundana. It was really insightful. So we have few questions with us from the audience. So we'll directly move to the Q&A session.
Sounds good.
So
Let's jump in.
yeah.
Thank you.
So I was also really interested to know how AI can take the healthcare sector. But definitely, there's question regarding that also. I also had the same question in my mind whether AI alone can take care of the entire process, where you have already mentioned like only the like definitely the human support is needed, human monitoring is needed. All other work like documentation and other things can be done using AI. So the same question was it was pointed out by one of the audience. So I'm not taking that question because you have already answered it, because we cannot completely trust or hand over the healthcare to the AI. So it's really interesting. No, it's